Good day, everyone. We are here to present the Lesson 13 Speech and Language Impairment. This lesson will help us understand how communication difficulties affect a child's learning and development. In our group, Tumayan Rodelin, Kantumayor Kate Hazel, and Torbat Jenny will guide you through the key concept, characteristic, and classroom strategies related to this topic. So before we begin, here are the objectives of our lesson. By the end of discussion, we should be able to understand the definition of speech and language impairment based on idea and other sources, identify the types of speech and language impairment, describe the characteristic of children who have this impairment, recognize the learning characteristic of affected learners, and discuss ways to support these learners through inclusion, accommodation, and adoption in general education settings. Definition: the Individuals with Disabilities Education Act (IDEA) defines speech and language impairment as communication disorders that affect a child's learning. These include fluency, articulation, language, and voice disorders that impact speaking, understanding, or producing sounds effectively. So, according to the Individuals with Disabilities Education Act (IDEA), speech and language impairments are communication disorders that interfere with the child's learning. These are communication disorders that affect how children speak, understand, or use language. They also affect learning and classroom performance. These are four main categories shown here: fluency disorders, difficulties with the flow and rhythm of speech like stuttering; articulation disorders, difficulty producing certain sounds correctly; language impairment, problems understanding or expressing words and sentences; voice impairment, issues with voice quality, such as sounding hoarse, nasal, or very soft. So, this condition can affect confidence, communication, and learning, so understanding them is important. Types of speech and language impairment. Types of speech impairment. Speech impairment are difficulties in producing sounds clearly, fluently, or with normal voice quality, affecting speech production but not language understanding. So, speech impairments mainly affect how a person produces sound. These include clarity of speech, fluency, and voice quality. It is important to note that speech impairments affect how words are spoken, but not how language is understood. Articulation disorders. These involve problems in physically producing specific speech sounds. Errors include substitutions, omissions, distortions, or addition of sounds. For example, saying wabbit instead of rabbit. Articulation issues often occur due to motor skill deficits or structural problems such as cleft palate. Phonological disorders. These involve difficulties understanding and applying the rules that govern sound patterns in a language. The child may correctly produce a sound but still use it correctly in certain words contexts. For example, deleting all final consonant in words. This shows that the problem is not the sound itself, but how the child uses sound patterns. Fluency disorders. Fluency disorders affect the rhythm and flow of speech, including stuttering with sound repetition or blocked and cluttering with rapid, disorganized speech. So, this pattern can make communication difficult and may affect a child's confidence. Voice disorders. Voice disorders involve problems with pitch, volume, quality, or resonance, causing the voice to sound hoarse, nasal, strained, or breathy, often due to vocal misuse, neurological issues, or structural abnormalities. So, these issues can be caused by vocal misuse, structural abnormalities, or neurological problems. Voice disorders may also make the child uncomfortable speaking in the front of others. Motor speech disorders.
Motor speech disorders result from neurological problems affecting speech muscles control. Dysarthria causes slurred or slow speech due to weak muscles, while apraxia involves difficulty coordinating speech movements despite normal muscle strength. So this condition require therapy focused on muscle control and movement. Resonant disorders. These occur when airflow and vibration in the mouth, nose, or throat are disrupted. Examples include hypernasality or hyponasality. Conditions like cleft palate commonly contribute to this impairment. So, if a child may have hypernasality, too much air through the nose, or hyponasality where nasal airflow is blocked, conditions like cleft palate commonly lead to resonant problems which can affect speech clarity. Selective mutism, although not caused by physical limitations, this condition involves a consistent inability to speak in specific social situations despite being able to speak normally in others. It is often associated with anxiety. So, selective mutism is not caused by physical problems. Instead, it is a condition where a child is unable to speak in certain social situations, such as school, even though they can speak normally at home or with trusted people. So, this is often connected to anxiety or extreme shyness. Children with selective mutism need emotional and psychological support.
Types of language impairment. So, language impairment is when someone has trouble understanding or using language to communicate. Think of it like this: language is how we share our thoughts and ideas. And if there's an impairment, it makes that process harder. What kind of problems can happen? Vocabulary. They might not know many words or have trouble remembering them. Grammar. They might mix up the rules or how to put words together in sentences. Sentence structure. They might have a hard time forming sentence that makes sense. Meaning. They might not understand what words or sentences mean. Social use of language. This is about knowing how to use language in different situations, like knowing when to be formal or informal or understanding jokes. Language impairment can affect different skills, like perceptive language, expressive language, and pragmatic language. Receptive language impairment. Receptive language impairment is like having trouble understanding what people are saying or what you're reading. It's not that you can't hear or see, but your brain has a hard time processing the language. What does that mean in real life? For following direction, imagine someone tells you to put that blue book on the top of shelf. If you have receptive language difficulties, you might not understand which book is blue, what top shelf means, or even what you're supposed to do it with the book. Grasping vocabulary. It can be hard to learn new words or understand what words mean in different contexts. Comprehending stories. When you read a story or listen to someone tell a story, it might be difficult to follow plot, understand the characters, or remember what happened. It's like trying to listen to a radio station that's not quiet tuned in properly. You can hear sound, but it's not to make sense of them. Mixed receptive impressive language. This is a kind of language problem where a person has trouble both understanding and expressing what they want to say. It's like their brain struggles to process the language they hear or see, and the same time they find it hard to share their own thoughts clearly. What issues that discussed? Delayed communication. They might take longer to answer questions or respond in conversation. Trouble answering questions. They may not understand questions right away or might give confusing answers. Unclear speech. When they speak, Their sentences might be disorganized or hard to understand. What causes this? Some people struggle with both understanding and using language because of certain conditions or developmental issues. It makes talking and listening difficult, and they might need extra help to improve their communication skills. Expressive language impairment. Expressive language impairment is when someone has trouble expressing their thoughts, feelings, or needs using words or sentences. It's not that they don't know what to say, but they find it hard to put their ideas into words clearly. What kind of problems does it discuss? Short or hesitant speech, vocabulary and grammar errors. They might use simple words or make mistakes when forming sentences. Difficulty sharing ideas. It can be hard for them to explain what they want or how they feel, especially in complicated situations. What causes this? It can be due to different reasons like brain injury, developmental issues, genetic factors, or medical conditions. Sometimes it's just a part of a language disorder, making it thought to communicate effectively. Pragmatic language impairment or social communication disorder. Okay, so pragmatic language impairment, also known as social communication disorder, is when someone has trouble using language in social situations. It's not just about knowing the words but also about understanding how to use them correctly in different social contexts. What kind of problem does this cause? Turn taking. They might talk too much or not enough in conversation or have trouble knowing when it's their turn to speak. Staying on topic. They might change the subject abruptly or talk about things that are not relevant to the conversation. Understanding social cues. They might miss nonverbal cues like facial expression, body language, or tone of voice, which can make it hard to understand what others really mean. Interpreting humor or figurative language. They might take jokes or idioms literally, making it hard to understand humor or sarcasm. It's like not knowing the unwritten rules or communication. They might say the right words, but the message doesn't come across as intended, or they might misunderstand what others are trying to say. Systematic language impairment. So, systematic language impairment is when someone has trouble understanding what words mean or how to use them correctly. It's like their brain has a hard time connecting words to their actual meaning. What kind of problem does this cause? Limited vocabulary. They might not know many words or have trouble learning new ones. Difficulty retrieving words. They might know a word but can't remember it when they need it. It's like having word on the tip of your tongue all the time. Confusing with multiple meaning or categories. They might not understand what same words have more than one meaning or how words it fits into different categories. For example, they might not realize that a bat can be both an animal and a piece of sports equipment. Like having a dictionary in your head but that definition are all mixed up missing. This can make it hard to understand what people are saying or to express your own thought clearly. Language impairment associated with neurodevelopmental disorder. So sometimes language impairment can be connected to others' conditions that affect how the brain develops. These are called neurodevelopmental disorder. What are some of these conditions? These conditions are autism spectrum disorder. This can affect how people communicate and interact with others. Some individuals with autism may have difficulty with social communication, understanding nonverbal cues, or using language in difficult ways. Intellectual disability. This can affect a person's ability to learn and understand information, which can also impact their language skills. They might have a smaller vocabulary or difficulty forming sentence. Attention deficit and hyperactivity disorder or ADHD. This can make it hard to focus and pay attention, which can affect language skills like listening, following directions, or expressing thoughts clearly. Hearing loss. If someone has trouble hearing, it can be harder for them to learn language. They might have difficulty understanding spoken words or developing their own speech. It's like if the brain is wired a little differently, it can sometimes affect how language develops and is used. This condition can make learning and using language more challenging. Morphological and syntactic impairment. So this type of language problem is all about having trouble with grammar. It means someone find it hard to understand and use the rules for making sentence correctly. What kind of problem happens? Verb tenses. They might mix up past, present, and future tenses. For example, saying, "Hey, he go yesterday," instead he went yesterday. Plurals. They might forget to add s or es when talking about more than one thing. Sentence formation. Their sentences might sound incomplete or not organized properly. Speech sound immature. Because of this mistake, their way of thinking might sound younger than their actual age. Basically, it's like they know the word but have trouble putting them together the right way, making their speech harder to understand or less clear.
Characteristic of speech and language impairment. The characteristics of speech or language impairment will vary depending upon the type of impairment involved. There may also be a combination of several problems. When a child has an articulation disorder, he or she has difficulty making certain sounds. These sounds may be left off, added, changed, or distorted, which makes it hard for people to understand the child. So, speech and language problems differ for every child. Some may have trouble making sounds, others with speaking smoothly or using their voice properly. These problems can make it hard for others to understand them. So, first, articulation disorders. Articulation is how we make speech sounds using our mouth, tongue, and lips. A child with an articulation disorder has trouble saying certain sounds correctly, like saying wabbit instead of rabbit. So, an articulation disorder involves incorrect speech sounds in production through substitutions, omissions, addition, or distortion that can make speech hard to understand. Fluency disorders. Fluency disorders affect how smoothly we speak. The two types of stuttering and cluttering. These disorders interrupt the natural flow of speech. So, stuttering is the child knows what to say but has trouble getting the word out. Example, repeating sounds or getting stuck. And then, cluttering, speaking too fast or mixing up words, making it hard to understand. So, there are three main types of stuttering like these fluencies: repetition, prolongation, and block. Individuals who stutter may speak with all of these fluencies or just one or two of them. So first, repetition is repeating sounds. Prolongations, stretching sounds. Blocks, no sounds come out. Voice disorders. Voice disorders affect how a child's voice sounds. They may sound hoarse, too loud, too soft, or have unusual pitch. Problems can come from misuse, illness, or issues in vocal cords. Voice problems can be organic, physical problems in the throat or lungs; neurological, nerve problems; functional, misuse of voice. There are many types of disorders that can change your voice. Some of the most common ones include laryngitis. So, laryngitis, swollen vocal cords. And then muscle tension dysphonia. It's a tight neck or throat muscle. Next, spasmodic dysphonia, spasm in vocal cords, vocal cord lesions, nodules or bumps, vocal cord paralysis, cords cannot move normally.
Learning characteristic. First, difficulty understanding instructions. Student may struggle to comprehend verbal directions, especially in instructions are long or complex. So it's mean that some students have a hard time following or making sense of spoken directions. They may struggle even more when the instructions are too long, complicated, or given too quickly. Because of this, they might not know what to do, how to start a task, or what step to follow. Second, limited vocabulary development. They often have smaller or less precise vocabularies, affecting reading comprehension and expression. So it means students know few words or do not know the exact words to express their ideas. So because of this, they may find it harder to understand what they read and also struggle to explain their thoughts clearly. And also, children with limited vocabulary may have difficulty understand what they read or hear because they are unfamiliar with many of the words used in stories, lesson, or conversation. Third, challenges in expressing ideas, difficulty finding the right words, or forming sentence to share thoughts clearly. This refers to situations where a person has thoughts or ideas in their mind but struggle to communicate them clearly. And also difficulty finding the right words or forming sentence to share thoughts clearly. This means a person may know what they want to say, but they have trouble choosing the correct words or putting them together in a way that makes sense. As a result, expressing ideas becomes slow, confusing, or stressful. Fourth, problems with reading and writing. Weak language skills can lead to challenge in decoding words, spelling, and constructing sentences. So this means that when a student has weak language skills, it becomes hard for them to read, spell, and write sentence correctly. Because they struggle with understanding and using language, they also find it difficult to break down words, recognize sounds, and form clear written ideas. For the decoding words, they may have trouble sounding out words or recognizing familiar words when reading. For spelling, they often misspell words because they cannot clearly hear or remember the correct sounds and letter patterns. And for sentence constructions, written sentence is hard because they may not know how to organize words or use proper grammar. Fifth, slow academic progress. Learning new concepts may take longer due to problems and processing and understanding language. So this means that a child may take more time than usual to learn new lesson or understanding schoolwork. Because they have difficulty processing and understanding language, it becomes harder for them to follow instructions, remember informations, or answer questions. As a result, they may need extra time, repeated explanations, or additional support to fully learn new concepts. 6. Poor listening skills. Trouble focusing on or remembering what is said, especially in noisy environment. So this means a child has difficulty paying attention to what others are saying. They may easily get distracted, especially when the environment is noisy. Because they struggle to focus on spoken information, they may forget instruction, miss important details, or misunderstanding what the teacher or classmate are talking about. This can affect how well they follow in lesson and complete tasks. 7. Difficulty in social communication. Challenges in taking turns in conversations, maintaining topics, or interpreting social cues. So means a child struggle to communicate well with others in social situations. They may have a hard time taking turns when talking, meaning they might interrupt or not know when it's their turn to speak. They also find it difficult to keep a conversation going because they can't maintain the topic or don't know what to say next. Low confidence and participation. Because of speech or language struggles, students may hesitate to speak or engage in classroom discussion. So this means that students who struggle with speech or language may feel shy or unsure about speaking in front of others because they worry about making mistakes, being misunderstood, or being teased. They may choose to stay quiet even when they know the answer. They repeating, avoid participating in group activities, recitation, or class discussions. Over time, these hesitations can affect their confidence, making them less willing to express their ideas or ask for help in class. So next, inclusion, accommodation, and adaptations in the general education. So first, inclusion. Inclusion allows students with speech and language impairments to learn alongside peers in a general classroom with support from teachers and speech language pathologists, promoting equal opportunities, confidence, and a sense of belonging. So the inclusion for students with speech and language impairment, inclusion means that students who have difficulties with speech or language are not separated from their classmates but instead learn together with them in the same classroom. With the help of teachers and speech language pathologists, these students receive the support they need to participate in lessons and activities. Inclusions promote equal opportunities, allowing them to access the same learning experiences as their peers. It also helps build their confidence, social skills, and sense of belonging because they feel valued and part of the classroom community rather than isolated. Second, accommodation. Accommodation involves adjusting how students learn or demonstrate knowledge, such as extra speaking time, visual aids, written instructions, or communication device without altering lesson goals, helping them access the same learning as per. So the accommodation means making change in the way students learn or show what they know so that their speech or language difficulties to do prevent them from succeeding. This can include giving extra time to speak, usual visual aids, providing written instructions, or allowing communication devices. The key is the learning goal and content stay the same. Students are still expected to achieve the same outcomes as their classmates. Accommodations help them access lessons fairly and participate fully in classroom activities without being limited by their speech or language challenges. Adaptation involved modifying lesson or expectations like simplifying content, shortening tasks, or usual visuals to match a student's communication needs, supporting learning in language development and their level. So the adaptation, changing the lesson or expectation to better fit a student abilities and communication needs. This can include simplifying in content, breaking tasks into smaller steps, shortening assignment, or using pictures and visual to help understanding. Unlike accommodations, adaptations may adjust what is taught or expected so the student can successfully learn and participate. So adaptations support the student learning and language development at their own level, helping them build skills without feeling overwhelmed or left behind.
That's all. Thank you.